Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. For the month of July, we're focusing on the health of Kirksville and the surrounding areas. The Northeast Missouri Health Council is a federally qualified health center, or FQHC, that serves folks throughout Northeast Missouri. At an FQHC, patients, regardless of income and whether or not they have insurance, can access a wide variety of services, including medical and dental care. Amy Baumgartner and Andy Grimm with the Northeast Missouri Health Council spoke about some of the services they provide to meet the dental needs of their community. Here's Amy.
Our program really started with a mobile dental truck, and the thought process is take the care to where they're at. Especially with the dental needs for our children, because it's hard for parents in so many rural areas to transport them and get them to one of the 3 locations we have, and then mom or dad's missing work, kiddos being pulled out of school, and so we purchased our first mobile dental truck, started taking it out to the schools that we'd already partnered with in a program called Preventative Services Program, which was a program that went to a lot of the schools and offered fluoride treatments throughout the school year. And we really found that after we started with our first few schools, many of the other schools saw that as a great benefit to keep the children in the schools and not have that disruption of them leaving. And so we've just added schools every year to that program.
We also provide sedated dentistry in the hospital for younger kids, and it can be as young as 3 years old, but usually 3, 4, 5, 6 years old, that have such decay in their mouth that it has to be treated before they even get to the point of having adult teeth. It's pain, it's infection, and a lot of those kids in a chair, it would take 15 visits. There's just a significant amount of work, and so we have been very fortunate to be able to provide a service in the hospital in participation with our pediatrics program and our dental program, where we can get all that work done at one time. Then we follow up with better, oral health habits and more frequent visits to get them engaged there. But by the time we get to a lot of these kids, it seems amazing that in just 4 or 5 years of being on the ground, that they're already at that point of such decay that it requires a surgery procedure to get them fixed up. And it's been averages about, we take referrals from all over the state. They've seen other dentists, whether it's FQHC dentist or ours or anybody else's. But if the child needs that level of care, they'll refer them to us. We have for about the last 20 years, pretty close to 20 kids a month. And you would think and hope that we would get to the end of that line at some point, but it just doesn't seem to ever get there.
That was Andy Grimm and Amy Baumgartner with the Northeast Missouri Health Council in Kirksville, speaking about some of the services they offer to meet the dental health needs of the community's youth. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.